Nigeria has launched a memoir to mark the country's becoming the 11th member of the Organization of Petroleum Exporting Countries. Amaka Udeh tells us more.
As Nigeria marks the golden jubilee of joining the Organization of the Petroleum Exporting Countries, experts believe the decision has enhanced development of the oil industry in the country. And as part of the gains, they say it has enabled the country to influence the growth and contribute to the survival of the industry globally. It has also placed Nigeria amongst nations engaged in the stabilization of the oil market. On the whole, they say the relationship between Nigeria and Opec has without a doubt been mutually beneficial. Are there any drawbacks? The introduction of a quota system to regulate the market is a cause for concern. Today marks 50 years that Nigeria joined the Organization of Petroleum Exporting Countries. And with the country's capacity of over 2.4 million barrels per day and the OPEC quota limiting the country to 1.554 million barrels per day as it stands right now, some analysts believe that the country is losing a lot of revenue to this quota system. But officials here today say it is a win-win situation for the country.
We really don't lose anything. Because, as I say, sometimes you lose from this side, but you gain from the other side. You all were here in 2020, at the beginning of the pandemic, when prices plummeted to dangerous levels. In fact, some grades of crude were sold for negative. That means that you have to pay for people to come and evacuate your crude. It was that bad. So in that kind of situation, if you have to cut your production in order to shore up the prices a little bit, it is in your interest. So the quota helps you to gain on the price side. Without the quota, you will not gain on the price side. The price, you can produce 10 million barrels and sell at zero.
The event was an opportunity to review developments in the Nigerian oil industry. While rehabilitations of the Port Harcourt refinery gulping over $1.5 billion, the federal government says plans are on the way to rehabilitate the Kaduna and Warri refineries in order to optimize oil production in the country.
The rehabilitation of Port Harcourt refinery is ongoing. And I want to also announce that in the next few weeks, the rehabilitation of Warri and Kaduna refinery will also commence.
Even as the organized labor and the federal government continue their engagement on what the appropriate price of premium motor spirits should be as the country moves towards full deregulation of the petroleum products, the government is insisting that the removal of subsidy is for the benefit of all.
This is desirable in the interest of the growth of Nigeria. Of course, everybody will have their own perspective, but from where I sit, I believe that subsidy is the best thing for Nigeria, not just for the industry.
And if any chair, on the 50th anniversary of Nigeria's membership, the Organization of Petroleum Exporting Countries has commended the country for the passage of the Petroleum Industry Bill. It believes that when it becomes law, it will guide relevant institutions, strengthen regulatory frameworks, and attract investment to bring the desired growth in the industry. Amaka Udeh, Arise News.
All right, thank you so much for that report there by Amaka Udeh. I mean, we've all been going through this celebration, as it were, 50 years in OPEC and what Nigeria has been able to gain from OPEC. I think in the course of the show today, we're talking about price stability, how OPEC has helped its bloc members and cartel members, to maintain price stability. But a lot of people have been talking about the future of OPEC itself, looking at the fact that OPEC has gone through many iterations. Now we have OPEC Plus and the likes, and the future of oil and fossil fuels and the likes. And these are conversations we'll have in the coming days. But when you look back and look at, remarkable moments in the history of oil in Nigeria and joining OPEC, things like 73 Yom Kippur War, where crude oil prices went from about $3 per barrel to $12 per barrel and the likes. And, Nigeria kept on making a lot of money. and the antecedents of Nigeria in the 70s, with the leader, the head of state saying the problem is not money, but how to spend it, and how the economy did grow as a result of oil proceeds and oil receipts, then you can say we've come a long way from OPEC. But the future has a lot in stock. Will fossil fuel crack it quickly? Would it be the next 50 years? Are we ever going to get to peak oil? I mean, those are the conversations. But on COVID-19, the World Health Organization scientist chief Soumya Swaminathan stated on Monday, the 12th of July, that there's a tendency for mixing and matching vaccine doses, and warned that it will be chaotic in countries if citizens start deciding on what should be done in taking a second and a third and a fourth dose. During the World Health Organization's regular briefing on COVID-19, Swaminathan said there are people who are thinking about mixing and matching. We see a lot of queries from people who say they have taken one and they're going to plan to take the another one. So it's a little bit of a dangerous trend where people are in a data-free, evidence-free zone insofar on mix and match. There's limited data on mix and match, and at the moment we only have data on AstraZeneca vaccines, Oxford AstraZeneca, followed by Pfizer. It will be chaotic in countries if citizens start deciding when and who should be taking a second or a third or a fourth dose.
It's a tendency now for people in countries with enough availability of vaccines to voluntarily start thinking about an additional dose. There are people who are thinking about mixing and matching. We receive a lot of queries from people who say they've taken one and they're planning to take another one. So it's a little bit of a dangerous trend here, where people are we're in a data-free, evidence-free zone as far as a mix and match. There is limited data on mix and match. There are studies going on. We need to wait for that, and maybe it will be a very good approach. But at the moment, we only have data on the AZ vaccine, Oxford AstraZeneca, followed by Pfizer. So it will be a chaotic situation in countries if citizens start, deciding when and who they should be taking a second or a third or a fourth dose.
Last week marked the fourth consecutive week of increasing cases of COVID-19 globally, with increases recorded in all but one of WHO's 6 regions. And after 10 weeks of declines, deaths are increasing again. We continue to hear reports from all regions of the world about hospitals reaching capacity. The Delta variant is ripping around the world at a scorching pace, driving a new spike in cases and death. Not everywhere is taking the same hit, though. We're in the midst of a growing two-track pandemic where the haves and have-nots within and between countries are increasingly divergent. Delta is now in more than 104 countries, and we expect it to soon be the dominant COVID-19 strain circulating worldwide. The world is watching in real time as the COVID-19 virus continues to change and become more transmissible. My message today is that we are experiencing a worsening public health emergency that further threatens lives, livelihoods, and a sound global economic recovery. AstraZeneca has led on licensing their vaccines around the world to increase vaccine capacity quickly. As well as Europe, India, and South Korea, I'm pleased to announce 2 more manufacturing sites in Japan and Australia, which have now received a WHO emergency use listing, bringing AstraZeneca's EULs to 5. This gives the green light for COVAX to buy vaccines from these additional facilities and enables countries to expedite their own regulatory approval to import and roll out vaccines. We need other manufacturers to follow this example.
This is still a global crisis, and it is a time to protect those who are most vulnerable in our society. And if we don't do that, and if we move on to other matters, then I think we will be judged a journalist asked before about the mass gathering events. We will look back in anger, and I think we will look back in anger, and we will look back in shame if we don't now move to use the increasing production capacity that's coming online, transferring that technology for even more capacity, using that to protect the most vulnerable, protect our frontline health workers everywhere in the world, take the death and the hospitalizations and the ventilators out of this pandemic, so we can then have more choices for broader coverage, for broader disease control, and for boosters and everything else that comes with it. It's not to say one or the other, it's putting things in a crisis in order. And what we've seen is vaccines are not perfectly effective at preventing transmission. They're highly effective at preventing hospitalization and death. And it is our view that the two measures together, public health and social measures, individual measures and vaccination working together, can keep this disease at some level of control without having to revert to these restrictive and destructive lockdowns. But our fear in this is if we rely purely on a vaccination policy when there are no vaccines for many countries, then we could easily end up back in a situation where countries have no alternative but to lockdown, because once you've seen it again and again, once hospitals fill to the critical level, once we see those images, governments are left with no option but to shut society down, to take the pressure off the health system.
SAGE, our strategic advisor group of experts, are definitely looking at any evidence coming through on the need and use for booster doses. But at this point in time, there is no data enough for us to point out the importance of booster doses. And particularly with the limited global supply, it is important to rethink if any country is pondering about increasing and using booster doses, and instead think of giving that supply or sharing that supply to countries that have not even reached their healthcare workers over.
Right, that's another story there, Doctor, like you saw it there, about World Health Organization and the fact they're saying we need to get coherent data rather than just mixing and matching, because with the COVID-19 pandemic and the fact that there are data on ground that shows that, you know, even after 1 or 2 shots, after your complete doses, you need to take a booster shot because the immunity starts to flat out after 6 months to a year. So a lot of people are saying, why don't we have, cross, vaccinations? In some areas, I think they've done some work, but it's not peer-reviewed enough. It's not bigger data enough. Some people have talked about the possibility of mixing and matching of vaccines, but the World Health Organization...
In Thailand,
The
government has already adopted this strategy of mixing and matching because, as Adesua pointed out earlier, they discovered that out of about 677,000 health workers and frontline workers who took the Sinovac vaccine, that was in February, they've now discovered that over 68,000 out of that number has died. And in any case, they also discovered through research that the Sinovac vaccine is just about 60 to 70% effective. So when they got the consignment of Pfizer and BioNTech vaccine in the month of June, they now decided that, look, many of these health workers, persons who have already taken 2 jabs of Sinovac, should now take the Pfizer vaccine as a booster. So that's the situation they have in Thailand. And it's as a result of the Delta variant going up. And the WHO official was talking about many countries, shutting down and all that. Yes, restrictions are being introduced in Taiwan, in Vietnam, in Singapore. Even Australia has had to shut down, parts of the country, principally because of the spread of the Delta variant, which they say is, more transmissible and is deadlier than any other variant that is out there, either the Alpha one or the Beta one or the Gamma variant. But in the U.S., talking about booster, vaccines, Pfizer has already approached the U.S. Food and Drug Administration
FDA
for approval, for the Pfizer vaccine to be taken as a booster after about 6 months, 6 months after you took your second dose. And in Oxford University, there's also a study about a month old now that I recommended that perhaps, it would be a good idea for people to take the booster shots. Because we've seen so many people who have taken 2 jabs, and in spite of that, they get infected with the Delta variant. But anyway, science will move ahead of the pandemic, hopefully someday.